So my name is Tengku Nohafiza binti Tengku Ibrahim. So today I would like to present about antihypertensive. So I will read the introduction first for your information. Okay. For information, antihypertensive is a drug to patients who have hypertension. Okay. Etiology number 1 is a specific cause of hypertension established in only 10 until 15% of patients. Number 2, patients in whom no specific cause of hypertension are said to have essential primary primary hypertension. Number 3, patients with a specific etiology are said to have a secondary hypertension. Number 4, genetic factors, which is there has psychological stress and environmental and dietary factor as contributing to development of hypertension. The heritability of essential hypertension is estimated to be about 30% only. So, right now I will read about normal regulation of blood pressure. According to the hydraulic equation, arterial blood pressure (BP) is directly proportionate to the product of the blood flow, cardiac output (CO), and the resistance to passage of blood through percapillary arterioles. Peripheral vascular resistance (PVR). And the next slide is blood pressure is maintained by number 1 is moment to moment regulation of OC and PVR at 3 anatomic sites. It is arterioles, postcapillary venules, and heart. Number 2 is kidney. Number 3, baroreflex mediated by autonomic nerve. Its combination with humoral mechanism, including the renin-angiotensin aldosterone system. And number 4 is local release of vasoactive substance.
Okay, hi, my name is Shamira Fazana binti Syedul Islam, and now I want to talk about side action hypertension drugs. We have 10 side action hypertension drugs. First, we have vasomotor center. In vasomotor center, we have 4 sites. First, metidopa. Second, clonidine, and third, guanabans. Second, in side action hypertension drug, we have sympathetic nerve terminal. Sympathetic nerve terminal, we have guanetidine and reserpine.
Good evening to everyone. My name is Vijayalakshmi, daughter of Anamudan, and today I would like to explain about diuretics. Diuretics are 3 types of chemical, and the first of all is thiazides, and the second one is hydrochlorothiazide, and the third one is chlorothalidone. The explanation of thiazide is thiazide diuretics such as hydrochlorothiazide and chlorothalidone lower blood pressure initially by increasing sodium and water excretion. Thiazide diuretics can include hypokalemia, hypouricemia, and to a lesser extent hypoglycemia in some patients. The second one is hydrochlorothiazide. Hydrochlorothiazide is a diuretic medication often used to treat high blood pressure and swelling due to fluid build-up. Other of uses include diabetes insipidus, renal tubular acidosis, and decrease the risk of kidney stones in those with a high calcium level in urine. The third point is chlorothalidone. The chlorothalidone is a prescription drug used to treat high blood pressure. It's meant to hypertension. Lowering high blood pressure helps to prevent stroke, heart disease, heart attacks, and kidney problems. It is also used to reduce extra salt. The second thing about B-adrenergic blockers are metoprolol and ethanol. Metoprolol and ethanol, which are cardioselective, inhibiting stimulation of B1 receptors. Sustained release metoprolol is effective in reducing mortality from heart failure, and it's particularly useful in patients with hypertension and heart failure. Ethanol reported to be less effective than metoprolol is preventing the complications of hypertension. The third thing is Nadolol and scatter non-selective B receptor agonists. Betazoolol and bisoprolol are B1 selective blockers. The second topic I want to explain is B-adrenergic blockers. B-adrenergic blockers are antihypertensive and do not significantly lower BP in normotensive. In stage 1, the cases of hypertensive patient, 30 to 40% of B-adrenergic blockers are used alone. First, B blockers show effective in hypertension and ischemic heart disease, largely replaced by the cardioselective B blockers such as metoprolol and ethanol. Useful for lowering blood pressure in mild to moderate hypertension, and finally it especially used in preventing the reflexasia that often result for treatment with direct basiodialysis. The third topic I want to explain is adrenergic blockers. Prazosin is a medication primarily used to treat high blood pressure symptoms of an enlarged prostate and post-traumatic stress disorders. It is less preferred treatment of high blood pressure. Other uses may include heart failure and Random syndrome. It is taken by mouth. Terazosin is sold under the brand name Hydrating, among others. It is a medication used to treat symptoms of enlarged prostate and high blood pressure. Phenobenzamine is a long-acting adrenergic alpha receptor blocking agent which and produced to maintain chemical symptom calmly by oral administration. It is increased blood flow to the skin, mucosa and abdominal viscera and lower both spine and airway blood pressure.
Next, I want to talk about vasodilators. First, hydralazine or dihydrazine and minoxidil not used as primary drugs to treat hypertension. Second, producing relaxation of vascular smooth muscle primarily in arteries and articles. Next, it produces reflex stimulation of the heart, resulting in the compensating reflex of increased myocardial contractility, heart rate, and oxygen consumption. Lastly, hydralazine is an accepted medication for controlling blood pressure in pregnancy-induced hypertension.
As you can see, at the slide. Treatment of hypertension in patients with concomitant disease. Okay, there's heart coronary disease, diabetes, cholesterol, heart failure, prevent myocardial infarction, chronic renal disease.
Uses of ACE inhibitors. Congestive heart failure or CHF. ACE inhibitors cause both arteriolar and ventilation in CHF patients. Reduce afterload as well as preload. Next, myocardial infarction is a long-term ACE inhibitor therapy reduces recurrence. Next, advantage of ACE inhibitor. First, free of postural hypertension, electrolyte disturbance, feeling of weakness, and CNS effects. Second, safety in asthmatics, diabetics, and peripheral vascular disease patients. Last, no rebound hypertension on withdrawal. Okay. Adverse effects of ACE inhibitors. The adverse effects profile of all ACE inhibitors is similar. Captopril is well tolerated by most patients, especially if daily dose is kept below 150 mg. Hypertension and initial sharp fall in BP occurs especially in diuretic-treated and CHF patients. Next, hyperkalemia, cough, rashes, urticaria, and last angioedema. To antihypertensive to be avoided during pregnancy and antihypertensive found safer during pregnancy. Let's talk about antihypertensive to be avoided during pregnancy. ACE inhibitors, RBS, risk of fetal damage, growth retardation. Diuretics increase risk of fetal wastage, placental infect, miscarriage, stillbirth. Non-selective beta blocker. Propranolol cause low birth weight, decreased placental size, neonatal bradycardia, and hypoglycemia. Salt nitroprusside, contraindicated in eclampsia. And let's move to antihypertensive, found safer during pregnancy. Hydrochlazine, methyl dopa. Dihydropridine, CCBS. If used, they should be discontinued before labor as they weaken uterine contractions. Cardioselective beta blockers and those with ISA, etanolol, metoprolol, pindolol, acebutolol may be used if no other choice. Prazosin and clonidine, provided that postural hypotension can be avoided.
Next complication of heart is heart attack. Hypertension causes the heart to pump against high blood pressure and make it work hard. This causes the heart muscle to think, and then restricted blood flow can lead the heart fail. Lastly, bone loss. High blood may increase the amount of calcium in your urine, and calcium may lead to of bone density, osteoporosis. Thank you. Next, I want to talk about vasodilators. First, hydralazine or dihydrazine and minoxidil not used as primary drugs to treat hypertension. Second, producing relaxation of vascular smooth muscle primarily in arteries and articles. Next, it produces reflex stimulation of the heart, resulting in the competing reflex of increased myocardial contractility, heart rate, and oxygen consumption. Lastly, hydralazine is an accepted medication for controlling blood pressure in pregnancy-induced hypertension. Lastly, I want to talk about complications of hypertension. We have 6 complications of hypertension. First, brain stroke. In brain stroke, it reduces blood supply to the brain and it can lead to rapid loss of brain functions of stroke. Second, blood vessel damage. It has atherosclerosis. Hypertension is a leading cause of atherosclerosis. The artery become narrow and the result is heart attack. Third, kidney fail. Damaged blood result in the kidneys cannot effective filter your blood. Result will be dangerous of fluid and waste. And then vision loss. High blood pressure can damage blood vessel in retina and the result will be loss of vision.